This is a Blend Extra. Well, doctors and healthcare professionals have been on the front lines during the pandemic, dealing with tremendous challenges that come with this deadly virus. Joining us now on ways we can show them our appreciation is our buddy. It's Dr. Ian Smith. He is the best-selling author and host of The Doctors. Hi, Ian.
Hey, Tiffany. Good to see you.
So good to see you. All right, let's chat about this. Let's start off by talking about our health in general. What do you think are some ways that are preventative and measures that we can take to be healthier this season?
Well, first of all, Tiffany, we've discussed this before, by the way, when I was on the show about the dangers that could come with cold and flu season while being in the middle of a pandemic. And so here we are. It's cold and flu season. People have got to use very simple preventive measures to help spread or to help prevent the spread of germs. Simple things like making sure you're sneezing or coughing into a tissue. If you don't have a tissue, use the inside of your elbow. Making sure you're washing your hands with warm water and soap for 20 seconds to get rid of those germs. If you don't have soap and water, use hand sanitizer. But the other part of it is the complicated part, which is here we are with a lot of symptoms that are with cold and flu, but also symptoms that are related to COVID. And so people have to understand that you got to pay attention to your symptoms. Things like chest congestion, cough, headache, fever, sore throat. Please do not ignore those things. Now, there is no cure, as you know, Tiffany, for the common cold and the flu, but there is symptomatic relief. Try to relieve your symptoms. So going to a grocery store or a pharmacy, buying some over-the-counter medication. For example, Mucinex has something called DM12-Hour, which thins your mucus, loosens it up. It also controls your cough, relieves the congestion up to 12 hours. But no matter what you take over the counter, you have got to follow the prescribed dosage. If your symptoms persist, after taking the recommended dosage in these particular times, Tiffany, you got to contact your healthcare professional to make sure that there are no next steps you need to take.
And I know that this year has been extremely difficult for healthcare professionals such as yourself, and as a doctor, you know best. But I'm wondering how you feel about people who give reviews on healthcare professionals and on their doctors. Do you like them, and do you think that they're beneficial?
Well, I think that if people are giving honest reviews about their experiences, they're extremely important to doctors. They let doctors know what their strengths and weaknesses are, where there's a gap in care, how they can improve, what are they doing well. But Tiffany, it's also important for other patients, because think about it. When we buy things these days, the first thing we do is read the reviews and see what other people think about it. Same thing with doctors. You're looking for a doctor for a situation. You want to make sure that doctor is the right fit for you. You're going to read the reviews. Last year alone, only 16% of people actually left reviews for their doctors. So this campaign is telling people, hey, go to healthgrades.com, leave a review for your doctor. Doesn't take a long time, and you'll help your doctor and other patients.
It's called Ally of Doctors campaign. What exactly is it?
So Ally of Doctors campaign is a great national campaign. It was started by Mucinex, and the idea is very simple. We want to show frontline workers that we love them, that we appreciate them, that we need them, and we support them. And so we want to rally the country around frontline workers who are really sacrificing their own health and lives and their families' health and lives so that we can be safer. So if you go to healthgrades.com and you leave a review, for every first review on the website, Mucinex is going to donate $20 up to $20,000 to the United Negro College Fund by the end of December 2020 to really help foster that next generation of frontline workers. It's really critical. It's important.
I love it. We got to support those frontline heroes. Thanks for joining us, Dr. Ian Smith.
Tiffany, great to see you. I'll see you soon, okay?
You too.